My name is Harriet. I'm going to be the moderator, and I work with Empowered Aid. In this webinar, I am joined by my colleagues who are also online from the Global Women's Institute. We have Jessie, Alida, and Vivian. So please feel free to introduce yourselves as we get in the chat, and also use the Q&A function to pose any questions to the panelists while they are discussing, just in case you have any burning questions that you want to put across. So apologies for the, I understand my sound output is not really so great. It's raining heavily right now in Kampala. So just in case of any interruptions in the network, my colleagues will be happy to jump in. But please feel free to plug into the chat in case you can barely hear me, and then we see what to do about it. All right, so I'll briefly start off by introducing the Global Women's Institute. The Global Women's Institute specializes in research on violence against women and girls and gender equality using rigorous and participatory research methods to create a knowledge base so as to inform programming and policies on several issues that affect women and girls. We do this while working with partners in both the humanitarian and development context. Next slide, please. I'll also briefly introduce you to the Empowered Aid Project. The Empowered Aid Project is a project of the Global Women's Institute that examines the mechanisms through which humanitarian aid is delivered and how these processes may inadvertently increase the risk of exploitation and abuse within affected populations. Its goal is to support the creation or adaptation of aid delivery models that actively work to reduce the poverty origin and also give women and girls a sustained voice in how aid is delivered. So in partnership with other operational agencies, the Global Women's Institute works with members of the affected population, and they are guided through a process of identification and prioritization of ways to improve the modalities used for distributing humanitarian aid in order to help minimize the risk of exploitation and abuse within the different processes and programming as well. Next slide, please. Empowered Aid has been in partnership with World Vision as well as other several organizations. These partnerships have been essential in supporting the work around the exploitation and abuse monitoring. We have adapted existing tools inspired by the work from the initial research that we did in Uganda and Lebanon that led to the development of the M&E toolkit for planning and monitoring safer aid distribution. This toolkit can be used by humanitarian workers as well as M&E staff or researchers who are interested in strengthening how they can monitor the risk of exploitation and abuse within different distributions in their programming. It has 4 tools in it. We have a safety audit, which is an observation tool that is administered when the distribution is happening. We have a point of distribution questionnaire, which is also administered during distribution. Then we have the household survey that is administered at least 2 weeks after the distribution has happened. Then we have focus group discussion. This toolkit is really quite it's rich in such a way that provides guidance on how to plan, also train the different teams that are going to be involved in data collection or analysis. We also train on collecting data, how to analyze the data. It also has a template for writing up the different findings. Next slide, please. We have developed a couple of tip sheets for different sectors based on different research that we've done. We have tip sheets on food assistance, on wash,
Yeah, I think I might jump in here just because, as I shared in the chat, unfortunately, it's raining really heavily today in Kampala, and so it's affecting Hope's internet connection. But just to say that these are our tip sheets. As Hope shared, they're on a number of different sectors that we've studied, and they're really designed for M&E specialists and all those working in humanitarian aid to be able to kind of easily see the recommendations around how to better account for SEA risk within monitoring and evaluation. And all of our tools and resources are available freely at empoweredaid.gw.edu. Next slide. So I'd like to take a moment to introduce our panel. We're really happy today to have members of World Vision that we've been working with for a long time on the project. And actually, Hope, I see you blinking. So I think your connection might be better. Let's see if we can continue with you. And please let us know in the chat if you're having any trouble with the sound.
Thanks, Alina. Can you hear me now?
Yes.
Great. Thanks everyone, and apologies for the interruption. So I'd like to introduce our panelists today. We have three wonderful panelists that we've been working with in different capacities. I will introduce to you first Nigusu. Nigusu Zelelke has 15 years of progressive professional experience in program design, monitoring, evaluation, and accountability systems. He is the design, monitoring, and evaluation specialist for the evidence and learning program quality and impact division in the international group of World Vision US. And also the program lead for Harriet 8 projects that is Washington. He has been providing M&E support to the SBA grant portfolio in 3 regions. He's passionate about indicators, impact methodology, program quality, as well as capacity building to project staff in the integrated human assistance project. Before joining the US, he worked in different World Vision US. He worked in different fields. He worked as a monitoring and evaluation project at FSI 360. He was a coordinator at UNFPA. He was a meal advisor at Save the Children. He has also been the medical emergency relief and international embassy specialist at social impact and the country head of monitoring at BRAC International. So Nigusu really has a vast experience as a principal investigator in coordinating and conducting research in the areas of development and humanitarian aid emergency programs. He also has experience in health, protection, GBV, WASH, nutrition sectors. He has completed a couple of masters, for example, M&A in sociology as well as social anthropology. So right now we are going to talk about our partnership, and I would like to ask Nigusu. You have overseen World Vision's partnership with Global Women's Institute on the Empowered Aid project in 6 countries over the past 5 years. What impacts have you seen on World Vision programming during this time, and what do you foresee in the future?
Okay, thank you. Thank you, Hope, for the brief introduction, and good morning, afternoon, evening, everyone. It's a great honor and just privilege to participate in this webinar. So I can highlight a brief World Vision partnership. World Vision has been in partnership with the Global Women Institute of the George Washington University since 2019. So the partnership has contributed to strengthen World Vision programming, specifically on ensuring access to humanitarian aid is safe for women and girls. And through this partnership, tools have been adapted to better capture women and girls' perceptions of safety and risk during the distribution process. So on top of that, staff have also been benefited from the just from the partnership through various capacity building sessions, such as training on gender-based violence, sexual exploitation and abuse, tools, data analysis, and also data collection. So the aim of this the partnership with the Global Women Institute or with the George Washington University was basically just to further embed safeguarding and World Vision existing programming and partnership by applying Empower participatory action or research. Because this project has been implemented in 6 countries: Uganda, Lebanon, Jordan, Kenya, Bangladesh, and currently we are now implementing in Turkey. Next slide, please. Yeah, so if you look at the, just some of the recommendations and findings, so especially, the most effective aspect of the projects are, the great resources. We'll discuss later, tools and training materials that are ready to use and even easily adapted to any contexts. And if you look at, just some of the recommendations and findings from, our project areas, take an example in Jordan. We women's and girls made structural observations around sexual exploitations, abuse risks at different points, especially in the distribution process, and they shared their contextual safeguarding expertise to identify recommendations, especially how to make accessing aid safer and reduce opportunities for sexual exploitation and abuse to occur. So those are actually just some of the recommendations and findings actually that applied and in Jordan in Azraq camp. So the Azraq camp is just to give you a highlight, it is a home to around I think 14,000 Syrian refugees, and it is the second largest camp in Jordan. So if you look at the picture, here is the male facilitator conducting an information session on GBVC to adult male beneficiaries, and also PSA messaging, especially on the NGO center, painted by women and girls, like if take an example, stop sexual harassment. So there was a lot of course, findings and recommendation, even including the sex disaggregation line at distribution points, aid delivery, and also assurance to men and girls, women, and there was also close supervisions of distribution workers. So those are actually some of the recommendations and findings of the project. So the project has just contributed a lot. We'll see actually later also, just the findings and recommendations from our team, Uganda and also Lebanon. Please, next slide. So next slide. Yeah. So if you look at this is the Bangladesh one, working closely with women and girls from crisis-affected communities, the Empower Aid, supports the creations and adoptions of aid delivery models that actively work to reduce specifically, the power disparities and give them, a sustained voice in how aid is delivered. So the implementation of this project has, equipped men and community leaders with the basic understanding of GBV and also held discussions to encourage communities, just to prevent GBV during aid services. So even the project has also even, just promoted awareness of GBV risks and protections, and even individuals have also, gained knowledge and risk, special risk avoidance skills, and even they supported also the formulations of women and girls leading groups. So if you look at here, example of improved signage around distribution, I mean, as part of the distribution, monitoring, the Global Women Institute or the George Washington University, they worked with World Vision Bangladesh, especially, just to adapt and implement the safety audits in the camp. So these camps, especially, these are the observational tools for, identifying risks and challenges, especially, just to save dignity and also equitable access. So based on that, the Global Women Institute Empowered Aid team, in partnership with the World Vision Bangladesh, they implemented 3 recommendations. So the first one is the increasing access, the number of female staff, and also creating functional sex segregation lines, and also increasing information provision on the PSA and compliant mechanisms. Please, next slide. Yes, thank you. The other one is for just in Kenya. So the Global Institute partnered with World Vision Kenya, basically, just to scale up interventions arising from complete research in Uganda and Lebanon. So we implemented this project in two basic refuge camps in Dadaab and also Kakuma. So during the contextualization workshop, women and girls identified several, accessing aid. I mean, including sexual harassment, especially when looking for the food or mistreatment or sexual harassment when accessing also medical services, or rape when accessing water and also firewood. So therefore, in order to just for these risks to mitigate it, the women and girls come up with several recommendations. So, like take an example in Kakuma, separate lines and corridors for the collection of food, and also sea awareness raising and training of security personnel, including police on GBV, and also handling of POC, people of concern, especially, the people of concern is to UNHCR is the, it includes, refuge, asylum, and also internal displaced person. So the sea awareness levels and overall, the adoptions of the sex disaggregated lines during aid distribution in the Kakuma refuge camp, based on the recommendations, as you can see here, of women and girls stands as a success story, in promoting safety, dignity, as well as the prevention of sexual exploitation abuse within the camp community. So these recommendations were, of course, adapted and integrated into the implementation of the, the general food distributions in both Kakuma and Dadaab refuge camps. Next slide, please. Okay, so when it comes to see the integration of monitoring and evaluation tools, just to monitor sexual exploitation and abuse risks in program, basically, in the second phase of the Empowered project, the recommendation that women and girls made during phase 1 were applied to aid distributions, and monitoring and evaluation tools were also adapted to better measure sexual exploitation risks. So the tools are designed to specifically just address known sexual exploitation risks, as well as also provide opportunities, to identify and build up on, what's working well and should be also content or explain. So the tools are intended actually basically, to help organizations or understand distributions or emergency related risks in humanitarian response, as Hope has already mentioned. So based on this, by conducting distribution monitoring during and after the distributions, we were able to measure aid recipients, perceived safety and risks throughout the distribution process. And, based on the findings, we learned that, applying recommendation like, increasing female staff and sex disaggregation lines during distribution, it allows females and girls to feel safe even during distributions and build trust also within the communities. And communities are also empowered more when they are given space to participate and contribute to the project implementation. So we have a lot of course, developed facilitations as tools. Even we introduced also the Empowered Toolkit for planning and monitoring safer. And also we have been engaged transporter or drivers, especially, to increase their knowledge and understanding of the sexual exploitation abuse. So we have been trained them in all the project areas. And also women and girls were also engaged, inform and research process planning, because we usually use the participatory action research or feminist participatory action research, and community sensitizations empower also communities. And also we have been, just submitted a lot of abstracts, like, for the SBRI forum in Mexico, and the upcoming SBRI forum also in Cape Town, the interaction forum. We have been even for Rwanda. So we have been involving in different international conferences. Those things enabled us to better measure, gender perceptions of safety and risks. Next slide, please. Yeah. So when I'm just thinking about the institutional uptake and mainstreaming, aid delivery systems must be, just adapted, just to meet women and girls' needs more fully in a way that, minimize opportunities for exploitation and abuse by aid as well as also non-aid actors. So as you can see, some of the actions women and girls recommended are relatively, just quick fix, that should already been in place. Take an example, ensuring sex disaggregation lines for collecting aid. But others may require, further discussions and planning, especially to execute in contextual, relevant ways that support women and girls and also do not put them at further risk of sexual exploitation abuse. So World Vision is now examining the possibility of, mainstreaming Empower Aid throughout its work in Azraq camp in Jordan, and having it formally evaluated to document the impact of the Empower Aid project. And that's the other one is use and adapt the Empower Aid toolkit guide further for, for programming, research, or advocacy needs, especially just to monitor for potential risks, and high level of visibility and sharing information with, with program participants about especially, sexual exploitation, GBV, and reporting mechanism. And also we integrated the Empower Aid, findings and recommendations in our, current projects. On top of that, training teams on GBV and sexual exploitations on the monitoring tools. I think maybe just we'll hear later from the Empower Aid project teams. We have already started in different languages, especially, just the online courses in 4 or 5, different languages. So everybody can also, if there is any interest to know more about the GBV and sexual exploitations and the monitoring tool, everybody can be, just join and attend also that online course. It's a free online course. So the team at the field level, they have already started that one. So the integration findings in the program scope of work, and the team from the Lebanon, Chourouk will further discuss that one. But generally, Vision Lebanon was also, able to build the capacity of even around 100 staff working directly through this project. Thank you very much, Hope.
All right. Thank you so much, Nigusu, for giving us a broader overview about the implementation of Empowered Aid and adaptation within the different countries. Our next panelist that I'd like to introduce is called Chourouk Kouteich. Chourouk is a dedicated gender equality, disability, and social inclusion expert, and is currently working in the same capacity as the Gender Equality, Disability, and Social Inclusion Technical Expert at World Vision Lebanon. With over 8 years of experience in the fields of protection, child protection, advocacy, and leadership, she's deeply passionate about advancing gender equality and driving social change and advocating for marginalized communities. Chourouk is committed to being an active agent of change within her community, actively engaging in civil society organizations to dedicate her skill set and time to meaningful causes. So, Chourouk, we have the World Vision Lebanon team was also engaged in adapting the monitoring and evaluation tools. Please share with us the process of adaptation and how participatory it was.
Yes. Thank you, Hope, and hello, everyone. So in World Vision Lebanon, once we received the concept of the project of Empowered Aid, and they introduced us the Empowered Aid tools mentioned before by Hope, the safety audit, the focus group discussion, the point of distribution. As a management team, what we did is that we engaged the main team. The monitoring, evaluation, accountability, and learning team, in addition to technical teams like safeguarding technical specialists, child protection technical specialists, gender technical specialists. We involve them in introduction phase when we introduce the tools, and we together in a workshop, we talk about the tools, what is feasible to apply in the context of Lebanon and in the context of World Vision work, especially, and to gather from them some inputs on how to improve the tools, what we add to the tools, what to remove from these tools, what is not feasible or not applicable here in this context. And to make sure that everyone is involved in this project, we involve everyone from the MEAD and from the technical specialists in a very collaborative workshop and brainstorming meetings to gather their inputs about the tool and to identify the strengths and the area of improvement of this tool. This was the first step for this phase to adapt the tool in a very participatory approach. Step 2, next slide, please. So in the step 2, we go more to build to involve the refugee women technical advisory group. So in Empowered Aid, as mentioned before, there is a refugee women technical advisory group. We're involved in the beginning of from the beginning of the research. So as World Vision Lebanon, one part of our project is to involve this advisory group in every step. So what we did to adapt the tool in Lebanon, that we introduced the tool to the technical advisory group, the TAG group, and we asked the women about the tools, and we gathered their inputs, their strategic insights or inputs about how to adapt these tools in Lebanon. How to ask these questions. Do you think these questions are applicable in Lebanon? It is sensitive questions or no? Do you think that the safety audit or the focus group discussion or the PODQ are relevant to the context of Lebanon? Will these tools support us to improve the way of distribution? Will these tools support us to hear more the voices of the women and especially the refugee women and girls in the distribution? So we did that with the women and girl technical advisory group. During our monthly meetings, consultation meeting, and we gathered from them the inputs. So now we have the inputs from the technical and the meal, and we have the inputs from the technical advisory group, the women technical advisory group. What we did that we adapt the tool based on the inputs, and after that we go for the step 3. The step 3, we go more about working on how to implement these these tools. So what we did, we built the capacity of the meal team. So we have a capacity building. We establish or develop a capacity building plan for the meal team involved in this project. So we identify people from the meal team that will help us to implement these tools, and they are the owner of these tools. So what we did is Empowered Aid with World Vision. We built the capacity of the meal team, focusing on new and adapted tools and data collection techniques to enhance their skills in using these tools, as these tools are somehow new for the team. So what we did, we identified around 5 members from the meal team, and with the support of Empowered Aid team, we did the capacity building on the adapted tools, and the meal team is now the owner of these tools. They implement the tool, they collect the data, and they do the analysis in coordination with us as technical and management team, and of course with the Empowered Aid team. The step 4 is about it's more about collecting the data, so and training the collectors, because we have the meal team and we have the enumerator. So what we did that we recruit enumerator to support in collecting the data and taking notes during the focus group discussion and interviewing women during the distribution. So what we did that we trained the enumerator involved in data collection on the adapted tool or the adapted tool, including training on how to do this tool, practical activities on how to implement these tools through role play activities, playing MoCA data collection exercise to simulate field conditions. And we also established channels for enumerator to provide feedback on tool performance and usability. So for example, at the first stage of implementing these tools, as World Vision staff, we did 1 or 2 days implementing of these tools, and then after the 2 days, we did a consultation meeting or feedback meeting with the enumerator. Of course, the meal team was leading this meeting in addition to our support as technical colleagues. So what we did is that we collect inputs from the enumerators, what went well, what didn't went well. So based on the feedback, we did also adaptation for the tool. So we work more on the adaptation of the tool based on the feedback of the implementation. We use this participatory approach because we believe that everyone has a voice, everyone has the right to influence the design of the project, to influence everything related to the project. And we believe that our team has the right to give inputs and to influence tools that they are new for them and how to adapt them in the context of Lebanon. So these are the main steps that we did in World Vision Lebanon to adapt the tools. Thank you.
Thank you so much for sharing your participatory process of ensuring that the different teams are engaged in the adaptation of the MFA tool. I would like to welcome our third and final panelists, Mercy Atim, who have had the absolute pleasure of working with in the implementation of expand aid in Uganda. Mercy is an independent protection and gender consultant in the humanitarian refugee response. Her work includes developing learning resources on working with women and girls in aid distribution, facilitating capacity building sessions for staff and community structures in child protection and prevention and response to violence, as well as developing proposals. She comes with a considerably 6 years experience in child protection, in emergency and protection in refugee communities, some of which includes leading the Expand Aid project in Uganda as well as Vision. Mercy, the Global Women's District has worked closely with World Vision, as we have been saying, to adapt existing distribution tool to better capture the risk of exploitation and abuse. Please share World Vision's experience of the community feedback received via these adapted M&E tools and how the team incorporated this feedback into their aid programming.
Thank you very much, Hope. And I am here in Bidibidi refugee settlement, and it's one of the biggest refugees in Uganda. And Empowered Aid was implemented in the refugee settlement. So the picture there is just showing our one of the recommendations of applying having the CR messaging out there, so the women and girls were able to see the recommendation and they're able to see how we can implement. Next slide. So how we implemented the adapted tools is World Vision staff and partners were trained on data collection, and this is how we got data. And the data we use safety audit. That's one of the data that was one of the tools we used. Then the point of distribution questionnaire. Then the post-monitoring distribution tool. And the mechanisms we used for getting this data was to get the recommendations was through using the tools, and also we had other feedback mechanisms that World Vision used. So we looked at the toll-free lines at every distribution point, and during sensitizations, the toll-free lines were read out and the community used the toll-free line really. And there was a staff specifically employed to answer and respond to the toll-free questions that were asked by the beneficiaries. And here we're able to get a lot of information and a lot of recommendations from the community during aid distributions. Then also after distribution, we conducted focus group discussions with the beneficiaries on how the distribution went and how they can give us, which feedback they can give us and how we can implement the feedback or the recommendation. Then at every distribution point, we have suggestion boxes. So the community was able to share with us their recommendation in suggestion box, and we're able to incorporate it in our programming and in our implementation during aid delivery. And the major aid delivery that we do in Bidibidi refugee settlement is food distribution, which is the biggest aid distribution in the settlement. Next slide, please. So how did how did the team receive feedback? As I've talked about it, through the complaint desks. So during distributions, there are always complaint desks, there are always complaints desks. And here, the complaints assistant sit at the end of the distribution to receive complaints or to receive feedback about the distribution. So this feedback, we put it in our recommendations. Then also through the post-distribution monitoring. Here the team or the M&E team and the assistants, they can go home to home collecting data, and here we were able to get the recommendations. Then we had also one-on-one sessions with staff. So here we're able to get the recommendations from them, to get the recommendations from our beneficiaries, among others. Then also we did intensive data collection. It was not like it wasn't like a one-time data collection. It was intensive in terms of we had to reach to every distribution point, so that we're able to get a wider range of information and recommendations. And we use multiple channels, which were both reactive and passive. Next slide, please. So these are some of the feedback that we adapted during the Empowered Aid, and also currently they're being implemented. We implemented sex segregated lines because our beneficiary, most especially the women and girls, were like, when we stand in line with the men, they rub themselves on us and we feel so uncomfortable. So we prefer standing in our lines during food distribution compared us standing in the same line. So this was taken seriously and we implemented this. Then holding community sensitization on GBV during distribution. So we realize information is power, and when the community don't know that what is happening to them is here, they can't report, or they can't say, no, that's wrong, you're doing something wrong to me. So the community, during distributions, we had sensitizations, and this were through the staff. And sometimes the community drama would come up with drama. There were drama groups that were put out there, so that they're able to give awareness about the dangers of GBV and SEA. Then employing more female aid workers, that is security guards and volunteers. So that is one thing that World Vision took very seriously, and we put up, they employed more security guards, and during distributions, there are always female staff, and also female security guards, and also the male security guards. The female security guards supported the women, then the male supported the male plus volunteers. So then we focused on safety at distribution points and traveling to and from the distribution. Here we encourage women to move in groups because during our engagement with the community women and girls, they say they mapped out the dangerous centers in the community. So we're able to tell them, you know what, you have to move in. Like they came up like, let's move in groups, or how do we overcome this issue? Then they come up with recommendations that we have to move in groups when we come to the distribution points, and also we ensured that there was safety of our beneficiaries at the distribution point. Then we expanded ways of working with communities in prevention of pregnancies, early pregnancies, and forced marriages. So during our intensive data collection, we realized that very many challenges that were given by the beneficiary was teenage pregnancy. So we're like, So in our sensitization to ensure that we incorporate in the dangers of teenage pregnancies, and also we advocated with other partners to ensure that we cap or we reduce and work with other partners to come up with messages to reduce forced marriage and teenage pregnancy. Next slide. So, and also we enhanced the SEER awareness through installation of signages at distribution points. So the signages were able to give more information about SEER and how the reporting channels and how they can get support in case something like that happens. The reporting channels were also part of the signages that we put out there at distribution point. Then assigning times for families to come and receive aid. So this is one area where not at the beginning, we had during distribution, we had everyone come to the distribution point. But when this recommendation came in, we assigned families to come at particular time. For example, family size 1 and 2, you come at this time. Families 6 and 7 come at this time. So that we reduce the crowd at the distribution point. Then, of course, we continued with implementing the SEER risk measures and safety recommendations, particularly as data collection participants. Their effectiveness for an increase of safety at the food distribution. Then we explored ways to provide transport support for formal and informal accompaniment systems. So here we talked to the protection partner, and we advocated during the protection meetings and the protection meetings with UNHCR and the protection partners, so that they come up with the transport mechanisms for mostly the people, vulnerable people, and these were like the elderly and the young children. And here they came up with structures. They came up with structures. We supported the vulnerable groups in the community. Structures are simple transportation mechanisms we use here in Uganda, and they run very fast. So I would say those are some of the recommendations we implemented during aid distributions. And also that data was used, we got data during the data collection using the adapted tools that we conducted during the Empowered Aid programming. Thank you so much.
Thank you so much, Mercy, for sharing the experience on how you use the feedback sessions. I don't know if that is your slides. Would you like to speak to that, or?
Sorry?
Would you like to speak to this slide, or would you like for us to move forward?
Oh yeah. So how, yes, please, sorry. How did we get the feedback session? Like Harriet, as I said, we worked with the advisory groups, and also we formed ambassador groups, and these where we included the segregated line, gender balance distribution teams with more female staff present at all times. So then also they talked about the washrooms, the latrines at the distribution points, where they had to be segregated, lockable, and private. So that's one thing World Vision took seriously, and ensure that all the latrines at the distribution points were segregated. Then we created and utilized multiple and diverse methods for sharing information. I've already talked about these methods, and also receiving complaints. That's about the complaint desks at the distribution points, the suggestion boxes at the distribution points, the toll-free line, which was well utilized, and we're able to get a lot of information it needs, and among others. Then we also identify ways of supporting transportation of heavy aid. Here, we're mostly women and girls or children with special needs. And here we advocated for the different transportation mechanisms in the settlement. And here we were able to use UNHCR and the protection partner were able to avail this transport mechanisms to support the vulnerable or the specific categories in the settlement. Then, of course, we trained staff on present to identify and monitor safety during distributions. This was something that was taken seriously, as my colleagues had said before. We took trainings very seriously as the Empowered Aid team. We're able to train all the staff on SIA, on managing SIA issues, and also ensuring that they're not able to commit SIA during aid distributions. Yeah.
Thank you so much.
Yeah, thank you so much.
Thank you so much, Mercy, for sharing your experience. And I believe most of these recommendations, as you can see on the screen, really are applicable, and organizations usually do pick up those that they are able to implement to strengthen SIA risk mitigation within their programming. Michelle, you did send a note in the chat asking about sharing about the tools. If you have a specific tool that you'd like for us to, we have 4 tools that we've talked about. If there's a specific tool that you want us to go a bit into detail, please feel free to write that in the Q&A section. Then one of the panelists, I'm sure, will be able to share that, as you've had they had experience using all of these tools that we talked about. Also, the Q&A section is still available and open to you. So as we wait for us to really type up some of the questions, I know maybe some of us are still reflecting upon what has been shared, and taking that up in. I would like to ask Chourouk a question as we also further internalize this. Chourouk did share the steps that the World Vision team in Lebanon did in order to be able to adapt the tools in a very participatory way. So moving on, I would like to ask Chourouk, what are some of the triumphs or the challenges that you have experienced in implementing these adaptations across different programmings beyond, for example, Empowered Aid?
Yeah, thank you for the question. I hope, yes, it's worth mentioning that these tools are now, they are mandatory tools in program in World Vision Lebanon, not only in Empowered Aid, because it was a lesson learned for us to use these tools. And the positive things about using these tools, it was that we were able to identify more SEA incidents through the focus group discussion we are doing with beneficiaries and participants, female and male, boys and girls, after the distribution or after any implementation of the project. So this was very successful method or successful tool to collect feedback about the distribution in general and to identify SEA, because during the focus group discussion, we ask people about SEA. We give them example about SEA cases, and we ask them if they hear about that or not, if they know about that or not. So that's why through the focus group discussion, we were able to identify these incidents. In addition, for the safety audit, was very successful tool, because we are now using the safety audit to assess the centers of our implementation, if they are safe for beneficiaries or not, if they are accessible or not, if there is any protection risk around them or not. One of the challenges we face, especially with the safety audit, that every time we need to do the safety audit, the one who is doing the safety audit or implementing the safety audit should be a protection worker at least, or someone who has the minimum knowledge about protection principles, standards, SOPs, about GBV, about anything related to that, because they need to know they need to have this knowledge, and they need to know about the protection measures that they need to observe and put in the safety audit. Yes, thank you.
Thank you so much, Chourouk, for sharing your experience. I see Rima has asked a question: where baseline and endline studies conducted revealing a reduction of SCA following these interventions? So this is open for both of you.
I can answer this question, Hope, if you want. So in Lebanon
Sure.
now, no, we don't have a baseline or endline studies to reveal a reduction of SCA following the intervention. But no, the tools help us to assess the safety of women during the distribution. We want to assess if this distribution is safer now or not, if the recommendation let the women and girls feel safe or not, if they recommend more recommendation or measures to implement in the distribution or not. But a baseline to assess if we reduce, actually, we want from the objective is to mitigate the risk of SEA. Reducing the SEA is something that it's not feasible and we cannot control. For us, the indicator of having more incident reported of SEA, it's somehow a positive indicator, because now people, they know more about SEA because of the GBD awareness session, because of the visibility, because of the help desk and complaint mechanism. Now they know their rights and they know they can report. So for us as organization, if we identify during this period more SEA incident, that is for us a positive indicator, because SEA is present, it's here. What we are doing here is to mitigate the measure that we can do as organization, to mitigate the harm we can do through the distribution aid or the way we are distributing the assistance. But to reducing the SEA, somehow it's not a smart objective for us. Thank you.
Thank you so much, Chourouk, for sharing that. And yeah, maybe I can also add, similar with different partner organizations. For example, even in Kenya, we had a similar process. Before the implementation, we had some sort of, we collected data to inform us what risk mitigation measures were in place. But also, again, at the end of it all, we wanted to understand if the feelings of safety for women and girls improved after the implementation of the intervention. So yeah, we do not measure the changes in around SCA reductions, but we are able to at least report around if women feel safe in different, for example, in the whole distribution process, right from the way they receive information or when they are the food distribution points or different points when they're traveling home, it is we are able to capture those feelings of safety or risk as a result of our engagement. I would like to read a question that was posed by Boniface. How were dramas conducted to ensure SCA incidents are reported? And how did the World Vision team know the messages in the drama were making references for a specific type of SCA? Also, what were the processes that were put in place to ensure that safe signaling of SCA incidents? So we are talking about the drama. Yeah, Mercy. How were they conducted to ensure incidents were reported, and then how the World Vision team know that the messages in the drama are making a reference to specific type of SCA?
Thank you so much. So World Vision worked with direct drama groups where the in charge, the officer, would give them messages. For example, in the next food distribution cycle, what are we doing? What information are we passing out there? So that information would be turned into a drama, and we realize that in the community, when we use words most of the time, sometimes they're thinking about so many things. They're thinking about getting their food and living. They're thinking about the different issues that is affecting them. So drama is eye-catching, and also it brings more attention. So we worked with like the different drama groups that were able to give out this information. Then how did the World Vision team knew the messages and drama were making references to a specific? I think I've answered this. As we worked with the different women and girls, they're able to tell us, or they're able to give us recommendations like this and this is happening. Maybe men touch us when we stand in the same line. So now we bring up, we come up with messages there. How do we show that when you're standing in the same line, this is what most of the men are doing. So how do we avoid this, or how do we implement this? So the drama group were able to act this out. Then what processes were put in place to ensure safe signaling of SEER instances? We had talked about the toll-free lines that were in place, and during our sensitizations, these toll-free lines were given out. At the end of the sensitization. They were written around the food distribution point, and there was serious emphasis that they should use those. Then also staffs were available where we encouraged the community to report directly to staff for any SEER incident, and how we then also there were different there were the suggestion boxes. I know that's like a long time where maybe, but we always looked at them at the end of the distribution if there was any, but also the community recommended that they would prefer using the toll-free line more, and also it was very effective. Thank you very much. Elaine?
All right.
Something?
Thank you so much for that. But also, I'd just like to add that it's really important for us to have good, strong, and functional referral mechanisms in place to ensure that, community members have access to this information, and when they go and seek support, really, they're able to get the support. It is also important to be able to link age-appropriate TPD survivors to different services, so that we have different services that cater for different age groups. Unfortunately, we've come to the top of our hour. We've come to the top of the end of our webinar. Maybe just in a minute, I'd like to ask the panelists if there's one final thing they would like to share or they are planning to do around their ACA program in Prioritize in 2024 in just 1 minute, 1 second, actually. Nigusu, would you like to go first in just less than a minute? What are the key priorities for you, for example, in 2024 around SCM risk mitigation?
Okay, thank you. Yeah, so the key priority, especially in the 2024, because this is now the project will be ending very soon, especially we are currently implementing in Turkey. So we are planning, just, to integrate, more of the recommendations and findings. So that's one of the top priority. And also we have the, an opportunity, of course, just to present the findings and the recommendations in different conferences and forums. So especially the SVRI forum in Cape Town. So hopefully we'll also, just share the findings and recommendations in that forum. So
thank you.
And yeah, thank you.
Chourouk?
Yes.
All right. Do you have anything to share as we wrap up, or are you okay?
No, thank you.
All right, Mercy?
Thank you. So I think something that we should take up is to continue giving out the awareness sessions on SEER to the beneficiaries, because we realize that when they don't have this information, they are not able to report. So that's one way they can be able to report. So that's one thing we can work on. Thank you so much. And we're going to continue working on. Thank you so much.
Okay. Thank you so much, Mercy, for sharing. Kindly give us feedback. We'd like to get your feedback. So we have a feedback survey that we request you to fill in. And we have a couple of resources. Alina has been sharing resources as we go along, but also you're welcome to contact us in case of anything. Otherwise, for the questions that remain unanswered, we are going to type them up. Thank you so much for dedicating 1 whole hour of your time really to come and engage with us. And also we have another webinar that is coming up in July. Hopefully you'll be able to sign up for that. So please keep an eye out. And also if you would like to join our mailing list, please feel free to let us know. Then you can be kept in the loop of the different activities that are happening within Empowered Aid and how you can be engaged. Thank you very much to our panelists and to the DWI team that has been supporting and to everyone that has been able to join. Thank you.
Thank you.